What if the next big leap in your career wasn't another weekend course, but a true mentorship pathway that made you undeniable clinically and professionally? And how about even financially? Today, I'm sitting with two freshly minted ECS clinicians, board certified in clinical electrophysiology, Dr. Lucas Brohm and Dr. Ryan Hamilton, graduates of our HODS residency program. We're going to talk about what it took, what surprised them, and how diagnostics, EMG, nerve conduction, and even MSK ultrasound can change everything. Stay with me. Welcome back to Your Practice, Your Money, where clinical success meets financial freedom. I'm your host, Dr. Dimitrios Kostopoulos. Well, if you are a returning listener, thank you. And if you are here for first time, please hit follow, subscribe right now on Apple Podcasts, Spotify, YouTube, or wherever you listen. Because every week we bring you real strategies that build stronger clinicians and stronger businesses. Today is a different episode. It is a proud episode for me because we're celebrating two new ECS achievers, Dr. Lucas Brohm and Dr. Ryan Hamilton, both graduates of the HODS residency program. And here's something that still blows my mind. In 2025, 18 out of the 21 clinicians who achieved ECS were connected to our HODS ecosystem. Our people, our mentorship, our standards. That's not a flex, all right? That's proof that mentorship and structure work. Luke and Ryan, welcome to the show.
Thanks for having us.
Glad to be here.
When you saw that you passed the ECS, right? What was that moment like?
A huge weight off my shoulders.
Same thing. Huge relief. I found out really early in that morning, and it was just, it just made the rest of the day great. And it was, so much time passes between when you take it, when you find out, you almost kind of lose a little bit of that anxiety, but it was just such a relief and just made you feel good about the day.
And I can say it's really cool being a part of a residency group of fellow clinicians. So I was able to share it with them, and, sharing a success always makes it a little bit better, especially people that know the challenges going into something like the ECS exam. So being able to share that moment with some coworkers, and especially, the people from HODS, you and Corey, being so excited for me, like genuinely excited that I was able to pass and take this next step in my career.
Did you guys know before you got involved in all this that as a physical therapist, you have the ability to learn electrodiagnostics, perform them, bill them to insurance companies, become board certified? Did you know all that? And how did your journey begin? How did you decide to be involved in this and as part of the organization you belong to?
I was definitely aware that PTs could do electrodiagnostic studies. One of my professors in school, he performed them. So I was aware of them, but didn't have a ton of background in it or knew much about it, honestly, until right before the opportunity came where we could be a part of the residency, maybe a month or two before we started. But I really wanted to be a part of it because there was a huge need in our community. I had a lot of patients that I was seeing that needed a test done, and they were waiting 3 to 6 months to get one. So I knew that there was a huge need for it, and I wanted to be a part, seeing that happen and being able to see that grow with our company too was just was a cool thing to be a part of.
How about you, Lucas?
Very similar story, being part of the same company. it was kind of brought to my plate. I was actually very hesitant to accept something new because I was recently finished with an orthopedic residency and completing the board certification for orthopedics. And I was like, I don't know if I want to take on another residency at this time. Starting a young family. So I don't remember if my wife was pregnant when I started or if she got pregnant during the journey, but pregnant with her third kid during the process. And, fortunately had a healthy birth. So it wasn't something that I necessarily jumped on right away, but I'm very glad that I did now that I'm on the backside of it.
I must say that not all organizations make the commitment to support their employees and associates on a journey like this, right? But you are part of KORT. The organization is, the acronyms is for
Kentucky Orthopedic Rehab Team.
Awesome. And absolutely congratulations to your organization, which I think is also part of Select Medical, for them making the commitment and then helping you to make the educational commitment. They make the financial commitment, you make the educational commitment to get through the program. So that is very well done. From the moment you started the program until you took your ECS exam and passed and became ECS board certified therapist, it's an evolution. It does take some time. It takes studying, preparation, and you learn as you go along through the program. But if all this process, I call it the ECS process, how does the pre-ECS Ryan compare to the after ECS Ryan, and how you utilize clinical critical thinking now versus before? What are the differences?
Before ECS, even doing these studies, as I was, preparing during the residency and to be able to sit for the test, I mean, in the beginning, it was like the cognitive load to get through just a basic carpal tunnel study, for instance, was overwhelming. You get done with 2 to 3 studies and then you get home that night and you're just like wiped out and exhausted. But as I've progressed and grown, and especially post ECS, my confidence and ability to recognize patterns is much stronger and better. I'm much more efficient, can get through a test much quicker, feel much more confident in just the technical aspect of performing the test too. Like if I don't get a response on a sural sensory, I know that I'm not getting a response on a sensory and I'm not questioning if I'm just in the right spot. I feel much more confident in my tests, my reports, being able to send them to providers and be able to get the patient the correct treatment that they need.
And how you, as a clinician, and your approach to patients and to treatment plans has been before HODS and after HODS, before you started your training, and now that you have pretty much getting to the level where you're at right now.
Yeah, I mean, so I think just having the ability to utilize diagnostics, I feel much more confident in my ability to diagnose them and give them the right treatment plan. But also, like, I just think my pattern recognition before I even do a test or a study has gotten so much better. I think before I went through the training, I had a huge bias to the spine being the contributing factor to almost everything. I didn't really give a lot of thought to peripheral nerve involvement much at all. And I know I missed things quite a bit, going before I went through the residency. So now I think just my ability to recognize patterns with patients, whether it's subjective complaints, but also just how I'm seeing the physical exam aspect work out, but then also being able to utilize the results to influence treatment and whether or not they're still appropriate for therapy or whether I should refer them out to a referring provider. Just the ability to utilize that has really just strengthened my practice and my ability to be a diagnostician, and also just helped me develop relationships with other providers too.
I feel like there's not really a comparison to pre-ECS Luke and post-ECS Luke. I thought I, was a well-established clinician, having gone through an orthopedic residency, which due to COVID, I actually went through essentially twice. And I came out, you think at that time, I guess it's the Dunning-Kruger effect. Like you think you know it all, and then you drop down, you realize you don't actually know anything once I start this process again. And then like coming back up, it's starting to realize like, oh man, like there was a lot I didn't know, but a lot that I also didn't consider, like Ryan talked about with peripheral nerve entrapments. And then just my ability to hear a subjective complaint and be like, oh, did you think about this? Like even with my other clinicians, like, I've got a large staff at my clinic. There's 6 on the physical therapy staff and 2 on the occupational therapy staff. And they'll come to me with a question. And now a lot of times I can answer it significantly faster. Like, oh, did you check this? Did you think about this? Things that I may not have even considered before. So just like Ryan said, the thought process, the clinical reasoning, pattern recognition, all of it together, significant improvement in my clinical skills. And, I thought about this too with the fact that my clinical skills have gotten a lot better. My diagnostic skills have gotten a lot better. I still utilize the EMGs, even if I can almost kind of determine the outcome, just because it helps me be solidified in whether this is axonal or demyelinating. And, I might be able to localize the injury, but knowing the severity of the injury and being able to determine the appropriate course of care. I mean, in the past 2 months, I've helped 2 or 3 people with lumbar radiculopathies make the best decision for them as far as surgical or non-surgical management. And just having that information has been, really helpful to be able to really be the true primary care musculoskeletal providers that we want PTs to be. I think this has really helped me take a step and lead into that role.
Thank you for mentioning also something specific about those radiculopathy patients. And if you can describe, let's say, a case that you have seen and you did an EMG study, and how you would have treated that patient before you've had the EMG tool, and how now that you got a specific EMG outcome that tailored your treatment and potentially your outcomes differently than it would have been before you had the ability to perform an electrodiagnostic study.
For this specific patient, she was having an L5-S1 radiculopathy. Like we knew it was a radiculopathy. She even had a L5-S1 disc herniation, and she was very close to having surgery because she was having such severe pain that she couldn't really get over the top of it. And I wasn't treating her beforehand, but I was like, why don't you come out and let me do an EMG? She came out, I did an EMG. We found that there's no new insertional activity going on. There's no membrane instability of the neuromuscular junctions of any of these muscles. There was evidence of polyphasics and long duration. So we're kind of in that subacute phase for her, but things are healing. And I felt very confident after doing that to be like, hey, let's try conservative a little bit longer. Let's keep going with PT. And, after like 3 or 4 sessions working with her, pain's pretty much gone. She's back to where she wants to be. And she was on the verge of having surgery. So this just gave us the confidence to know that we could push through that pain because we didn't have any new axonal damage going on.
Very good. And how about you, Ryan? Anything comes to mind?
Yeah, so I mean, I had a study earlier this week actually. It wasn't my patient, but it was another therapist that sent me this patient. They were seeing them for a suspected radiculopathy. The patient was not responding favorably to that. Had paresthesias in I think digit 1, 2, and 3, mostly night symptoms. Had a lot of symptoms consistent with CTS. Did the EMG. Definitely, there's evidence of a moderate carpal tunnel syndrome with axonal involvement. No evidence of a radiculopathy with this patient. So it really changed how the therapist was going to manage it. I gave him suggestions, maybe stop treating the spine, start looking at more neurodynamic exercises, look at using potentially a night splint, things of that nature, and then also referring them to a hand surgeon just for evaluation. And then the patient was very just happy. The patient almost had thought that they were crazy, like they weren't getting better with anything. And now this kind of validated that their symptoms were real. And we could be more specific with how we're going to intervene and treat that patient.
In the clinic, how your relationships are with those other therapists who have not been trained in electrodiagnostics. How's that relationship and how that communication or the collaboration takes place?
One of the benefits of being a large organization is we can get patients referred that are internal based off of like our centralized scheduling system. And a lot of times it ends up being that way. The preferred way, though, is to have a more personal conversation with that therapist. So many times in my scenario, I'm in a smaller clinic. So, I do get some patients referred within my clinic, but most of them are coming from some of our other clinics that are close to me. They'll either call or text me or send me an email about the patient and whether or not I think there'd be a benefit to do a diagnostic study with them. And then usually if I think that's the case, we'll go ahead and get them scheduled and get the test going. But a big thing that we're trying to do too is just improving this communication, and we're constantly trying to evolve it by reaching out to the clinics, kind of giving them demonstrations. We've done just numerous different types of education to try to continue to grow that aspect of our referrals.
Initially growth within other therapists has been a little challenging, especially as we're going through the program and learning. So it's hard to get somebody on board when we're in that learning phase ourselves. Now that I feel like I'm really over that and ECS certified, I feel like I can communicate with my staff therapists significantly better, and starting to see a little bit more utilization into practice and feeling comfortable when to refer and not refer. But that has been a little bit of a hurdle, is trying to educate people who are not involved in EMGs, specifically therapists not involved in EMGs, how much it can impact and change your practice. And, it's one of those things that once you use it, it's like, I can't imagine not having it in my practice now.
Most of the listeners, they have no idea like exactly the specifics about the program and how it rolls out and everything. But many people may think that you just go to a classroom, and just because you went to a classroom for a couple of days, you learn how to perform this. And it is not like that at all. You are getting, and you need to get, live mentorships with real patients. You need to get report reviews where your errors are being pointed out, and then you improve yourself through the process. Can you just comment a little bit of the importance of the mentorship process, the report review process, versus just sitting in a classroom and just doing a couple of sample cases?
To your point, like once we've got done with just the classroom aspect of this, that was all we had, you would be lost, because it's much different when you got a real patient versus just testing on each other. So you definitely need that in-person mentorship. It makes all the difference. For one, you have a kind of a sense of more confidence when you have your mentor with you, especially early on when you're not confident in what you're doing, but you have this experienced therapist who does electrodiagnostics sitting there with you, so you can lean on them if you need to. And many times you're going to encounter kind of interesting patient presentations and diagnoses that they can help work through with you. Even now, I'll have a case that comes up that I have never seen before. And now that you're ECS, you do see all these kind of interesting cases that you weren't seeing before. And he's available now. I mean, I'm done with the program, and he takes time out of his night, and we'll talk for 30 minutes to an hour on, patient presentation and what, has he seen this before, or what he would suggest or what he thinks going on. For one, it's just nice to have somebody to be able to lean on even now as a mentor. Sure, it just facilitates such growth throughout the year or 2 years it takes you to get through the program, that you wouldn't be able to get that without having somebody on site with you.
Again, I'd agree with Ryan, and I'd also add in just some of the technical factors of the test. I'll never forget you coming around in probably our second weekend course and unplugging things from the machine. And that alone helped me just like thought process through the test. So now I know, like, hey, if something's not right, I methodically go through each little step to make sure all of my connections and everything from a systematic standpoint is set up correctly. And I can't tell you how many times that's fixed a problem that I may have been struggling through a whole test without. And so it's like, I don't know how you could really learn that without somebody being hands-on teaching you.
Thank you, guys. And those of you who are listening to us right now and want to find out a little bit more about the program, of course, you can go to our websites, handsondiagnostics.com or emgncv.net or aamskus.com, and you can get more information about all of our programs. But I make myself personally available to meet with 2 people every week who want to discuss about the program, find how suitable the program is for them. you can go to meetwithdimi.com and you can pick an available spot on my schedule to meet with me. Any final words that you guys have for the people who are potentially considering to be involved in electrodiagnostics, being skeptical perhaps to join a residency program? Any kind of advice or final words you have for them?
Take the jump.
Take the job. Okay. All right.
Yeah.
Good.
I agree. It just changes your practice in so many positive ways to be able to be, like Luke said, a primary musculoskeletal provider, and being able to diagnose a patient and shape their plan of care based off what you find. It's a lot of work, but it's manageable, and it's well worth it.
Awesome. Ryan and Lucas, congratulations again. You guys have earned something that represents expertise, discipline, and commitment to patients that is rare. I keep saying that in the country, we have, I think, more than 25,000 orthopedic certified clinical specialists. In clinical electrodiagnosis, we have, I think, somewhere around 250 at the most. So you guys are right up there at the cream of the crop. Very proud of you. To everyone listening, if you are tired of feeling like you are guessing, if you want the confidence of clarity, and if you want a career path where clinical excellence actually translates into opportunity and financial freedom, this is what this structured mentorship and diagnostics can do for you. And if you enjoyed this episode, please do me a favor, subscribe, follow on Spotify, Apple Podcasts, YouTube, or your favorite platform, and share this with another clinician friend of yours who may be hungry to level up. That's how we grow this movement. Lucas and Ryan, thank you for being here. Appreciate it.
Thanks for having us.
See you next week. And until then, keep building clinical success and financial freedom. Take care, everyone.